good day, everyone, wherever you're hearing my voice from. My name is Otaigwe Is, a representative of the Express Med Global Services brand, popularly known as EMGS. And for us as a company, we have a vision that says every household deserves a representative abroad. And in order to ensure that is happening, we take some active steps to make sure that people within our community and even outside are able to take advantage of our numerous services and also are able to gain access to relevant things that will help to enhance or fasten up their duty or their aim. So we welcome you to this session of our interview preparation. If you are joining us for the first time, we always do this regularly from time to time. And by now, you might have come across our videos from previous interview sessions, and you might have seen how interactive it can get. We are here to come and make all the mistakes. We want you to make all the errors so that on your interview day, you can go there and smash it. Frankly speaking, getting interview nowadays is not as easy as it used to be. So we don't want a situation whereby you come here and you just come and be muted. No, please. At least you have to encourage us to encourage you. So you have to put in your best, make all the mistake here. There's always a popular saying that a closed mouth is a closed destiny. So if you close your mouth in the session and you think, oh, when I get to that interview there, I'm going to smash it and I will give them marking criteria. What if what you want to go and use to go and give them marking criteria is not even the right thing? So come and make all the error here so that we can be able to correct it. We want you to really succeed. We want you to have multiple success stories as it relates to your interview. Now, just a bit of a background. The whole interview preparatory session is born out of the EMGS job application arm. So you already know that for us as a company, we do support people with job application. And to God be the glory, quite a lot of persons have been successful so far. And our job application services is not a guarantee. And we keep emphasizing that. It doesn't mean when you use EMGS job application, you will just get job. No. But to God be the glory, quite a lot of persons have been getting job. I was speaking with one of our colleagues who is even a part of this session. And when I was telling her about the whole job application thing, she was skeptical. But yesterday, she was reporting to me that she has gotten about 4 jobs from our team, and she has already secured an interview already. So luckily, she was able to join us here. So that's a good one. The disadvantage thing is, it doesn't mean that please mute your mic. Informa. So the disadvantage thing is not that everyone that just applied through EMGS will get their job. You can also do your application yourself, and then you get your job. But as we always say, spread your tentacles. Not only EMGS, there are other platforms that also apply for job for people. So if you trust them and you believe in what they are doing, utilize their services. We are not telling you to come and use EMGS all you know. So we discovered that most times when we do the application and people get interview, and then they go to the interview venue, and some are not able to do well. So it's a fallback on that. We can do a lot for them to make sure that at least when they go for this interview, even if it's not guaranteed they will just smash it, at least let's increase their chances by letting them know what they are supposed to know and get to prepare them beforehand so that when they get there, they can be able to smash it. And successfully, by God's grace, quite a lot of persons have been able to utilize the services, and it has been really, really impactful. So for your information, this whole interview preparatory session is entirely free. But we do have 2 arms of the interview preparatory session. We do have the one-to-one session, the subgroup, and then the general group. So the difference in the various packages is this type you are saying now is free. We do have the one that you will want a sort of a concentrated session that will focus on you. So you want to ask some deep questions, or you want to make an interactive session. Let's get to see how you have been preparing or how well you are prepared. So in that kind of case, we call it one-to-one session. And in that one-to-one session is the type that we usually request that you make a commitment fee for that sort of interview preparation. So if that is the type that you are aiming for, obviously, you should know by now the link to our customer care. So hopefully, I will also share the link of our Telegram group to the platform so that you can be able to have access to EMGS customer care. By going through P messages on Telegram, you can be able to see those. Now, that also reminds me, as part of these extended services, EMGS over time have been compiling past questions, and those past questions are not put together by Otaibe. No, they are not put together by myself. They were put together by people that have gone there to write their interview before. So the essence of that is to help guide your pathway so that nothing will be new to you on your interview day. So we appeal to you. The group now is over 10,000 persons, and there are myriad of past questions, countless past questions. Some will try to pin, some will pin, and then they will pin themselves. But just scroll through the group, and then you can be able to navigate and utilize the past question that will be able to help you. While you might be preparing, try to practicalize and familiarize yourself with as many questions as possible. Because if your knowledge is very broad, chances are, no matter how the question comes, nothing will take you unaware. Unaware question only happens if you do not have the necessary skill and knowledge. So if you do have the necessary skills and knowledge, the whole process will be a lot more easier for you. Now, with that being said, there are previous videos we might have done before that has to do with your preparation. So this is more like a sort of a continuation in a way. So please, we always appeal to you. Put your data to use. Don't always think of, do I have data to watch? Do I have the time to watch? Always look at the good side of things. Why are you watching this thing? Because you want to secure your interview. When you secure your interview, what do you stand to gain? you want to make a better life for yourself and your family. So if to make a better life for yourself and your family, the sacrifice you need to make is to watch interview video. Why don't you watch it and make that tremendous impact for yourself and your family? And if you watch the videos and it impresses you and you are happy by what you are seeing, why don't you like the video, so that subsequent video done will equally keep coming to your view, so that you will know that certainly whenever you have anything relating to preparation as far as interview is concerned, and we happen to drop things of such, you'll be able to get to be notified. So that's basically it on that. Now, there have been a lot of trend recently where you already now know that getting job is very, very difficult, and getting interview is very hard. So we want to ensure that everyone that gets that interview, and they are able to perform well in the course of their interview process. And again, that is why we're having this session. Now, please don't give up in your application process. Soon, there will be loads of vacancy. Everything is all about timing the market. Your colleague might have told you that, oh, don't do self-sponsorship, you will not see job. Some colleague might have told you, oh, don't do your verification, you will not see job. Don't believe anybody. Do your thing that you need to do, you will find job. Follow most of the webinars we might have done in the past that is pinned on Telegram. Some are hosted on Twitter Space, some are invitation for other YouTubers that also are interested in other people's sources. And take your time and watch those videos. It will go a long way to help you. Now, for those of you who have a back on self-sponsorship, and you might have been seeing that negative narrative that, oh, it's so difficult to get job nowadays. There's no job anywhere. No, there are jobs everywhere. It all depends on the approach you are following. So as we always tell you, if you are focusing on the UK or you are focusing in any other country, most of these countries, they are very large. As you have the city side of this country, there are the remote area. So you can begin to target your application to the countryside, the remote area of these countries, rather than only focusing your attention on the city side. So if you get the job in the remote area, you can always make a transition to the city, as long as you are now already a part of the country. Another thing I want you to be aware of, in case you are discouraged and thinking, oh, or you are in the verge of embarking on self-sponsorship. I know this session is not about self-sponsorship, but I do know that quite a lot of persons are kind of confused at this stage, and they are thinking, what should I do next? So if you are in the verge of and you are capable, please try and do it now that you still can. Now, the reason why I say do it now that you still can is this. You might not have been aware, Australia opened route for most UK nurses starting in this month of April. So very soon you will be seeing quite a lot of UK nurses flowing to Australia. Now, you are already aware that there has been a whole lot of a backlog of nurses aiming to go to US. And as a result of this ongoing backlog, a lot of nurses that have since done all the necessary registration, they are still on the queue waiting for US to open doors for them. So US process is again increasing day by day. So very soon, quite a lot of nurses will be transitioning to the US. So by the time a lot of nurses leave to the US and a lot of nurses leave to Australia, which is the new trend now, frankly speaking, there will be loads and loads of vacancy in the NHS. Now, when there's loads and loads of vacancy in the NHS, you will be seeing the recruitment as it used to flow those days. Now, when it starts flowing as it used to flow those days, priority will be given to those who have PIN. So that's why I'm telling you, if you can, if you have the strength and you have your calling, not for you now because you already have interview, and I believe you are going to smash it. If you belong to groups and the people are asking you, oh, they are not seeing job, instead of you to discourage them, encourage them, right? Because there is what they call opportunity, being that, or sorry, luck is when opportunity and preparedness meet. It is not when those opportunities now open, you will start running for self-sponsorship. Then it will be too late. But those who are already self-sponsored and they are prepared, they can easily just take advantage of the opportunity and fly or move along with it. So that's basically it on that. So let's go back to our interview preparatory session. So once again, welcome aboard to this session. Basically, from our previous video, you will have seen that we try our best to integrate you with things that you should expect in the course of your interview session. You should prepare yourself background-wise and so on and so forth. And I believe by now, all of us are already familiar with all these things. So please, we encourage you, try your best to ask questions if there are questions that are challenging you. And most of these questions are going to be tackled by all of us right here. So that's basically it on that. Now, I want you to forget that your supporting information now. I want you to forget that your CV. It is time for you to do the needful. Your CV, your supporting information has done their due diligence. They have gotten you that job. Know some of you now, you are wondering, you want to study your supporting information to know how you were, what you wrote there, and so on and so forth. Frankly speaking, quite a lot of persons that will be present in your interview, they may not even know about your supporting information. So most times, organization or large organization and corporation are structured in such a way that there is a system. So in the system, everybody have their role. You can see in the course of this session, the first time most of you might be meeting me might not be now. or maybe during the course of your OSCE physical assessment, or any other session that we might have met before. After that, you might never have met me. Some of you might have been leaving me 18 and I delay in replying. I reply you as swift as I can. That's just the only interaction. But there are part of our company member, there are other members of our company that you might have also interacted with that have been supporting you all the while. So that's how system works. So basically, the people that screen your application before you got into the interview phase may not necessarily be the people that will be conducting your interview. So don't be worried and be saying now that, oh, it's time for interview. You're not going to carry your CV. To say, okay, let me study my CV very well. Your CV has done its work, and your supporting information has done its work. Your whole due diligence now will not be what are the trusts asking for and what are they looking for. Now, for our previous interview session, you will hear we say this continuously. Interview is what? Telling the interviewer what they want to hear. Interview is telling the interviewer what they want to hear. Please mute your mic. Is telling the interviewer what they want to hear. Now, this interviewer, they came in for something and they want to know. Nosti Amaka Emeji, please mute your mic. So they came into this session because they want to hear something from you. Your ability to reproduce to them what they want to hear kind of puts you at a higher pedestal among your colleagues. Mind you, there are quite a lot of persons that are being interviewed for the role. So that brings about increased competition. So the better you are able to perform in the course of that session, the better or the higher your chances of being selected. So please focus your attention now on what the trust is asking for. Now, there are some of you have some unique characteristics that separate you from among your colleagues. It might be that you were one of the most exceptional students of your class, the best graduated student, you were a politician, you were, let's say now you in your world, you are very unique, they know you for something, maybe you are good in calculation, or you're a good leader, you're a team lead, and so on and so forth. Please don't wait for them to ask you or what sets you aside from your colleague before you start adding those. So in the course of your interaction, any opportunity that come your way for you to be able to inject it, go ahead and inject it. It matters a whole lot. It matters a whole lot. It matters a whole lot because you see some footballers display exceptional skill today when they are playing their game. Football game only lasts for about 90 minutes, but most of these footballers have been training time in, time out on a weekly basis or on a daily basis before that one day they will eventually play that match every week. So it is the combination of so many training they are putting for over a lot of time that they eventually will come and display in one game. So you have been putting up a lot of training over time. So when you come to your interview, it's not that time you will not be shy. So don't wait for them to start asking you what sets you apart from others before you can begin to say your distinctive features. So please, it's very, very important. Now, for this session, or as you might have heard in our previous session, there are factors that will affect the success of your interview. There are factors that will affect the success of your interview. And we always let you know that 3 of these factors are factors that you can control. However, there is one that is not under your control. So please, please, focus on the one that you know they are under your control. If you have an opportunity to even look at it on a normal stage, no student will score 90% in an exam and they will say the student failed. It's not possible. You score 90% in an exam, ideally, you should be able to pass very well. So if there are 4 factors and 3 are under your control, it obviously means that you have an upper hand. So please focus on the factors that are under your control. So if you have followed our previous session, you will be able to have idea about these factors that we are talking about that are under your control and the ones that are not under your control. Now, some of the factors that will affect your interview on the day of your interview will be number 1, you yourself, you as the person, your preparation, how you are able to answer the question, how you compose yourself, your confidence level, and so on and so forth. Now, I know that quite a lot of persons, especially those from the developing world, let me not mention any country now, because of the way healthcare is structured in those settings, there's this sort of a big respect that we usually give to those who are senior to us. And because of this huge respect margin, we tend to not bring out unnecessary fear. So please, interview is not an avenue for you to be fearful. You'll be preparing for this over time. The person that's even interviewing you may not even have as much experience as you do. So you want to show them as much as you can that you know, as long as you know it is right. Remember, interviews what telling the examiner what they want to hear or the interviewer what they want to hear. You want to tell them what they want to hear, not what is irrelevant to the subject. Because not that you are not good, everybody already know you are good, you are announced, you are everything, but they have what they are looking for. So you want to give it to them what they are looking for. And the best way for you to know what they are looking for is what? By reading through the interview supporting the interview personal specification and job description. Now, if for us as a company we did the application for you, you can still reach out to whoever handled the application, and they'll be able to download the session and send for you. Otherwise, you can also download the session by yourself. So please, that's on the personal level. Now, the second thing that can affect your interview, which you might already have been, which is already been detailed in previous video, is your environment. So we'll take to the time with a number. It's not on the days of your interview you will be keeping secrets. You don't want anybody to know you are holding interview. And then when the session starts, you'll now see people are coming to knock on your door. So it can also display sign of not being serious. I know that there are some things that are not under our control, but if it's under your control, please control it. Now, another thing that can relate to your background will also be your obviously your ability to suppress noise. You don't want a noisy background in the course of your interview, so you want to put in everything to ensure that on the day of your session it is noise free. So another thing too is the device that you are using. So please charge your phone. It's not during interview session you will not be saying that, oh, my battery is just 2%. So please, we also encourage you have a writing material for your interview session, have a jotting material. So please, sometimes they can be quoting figures for you. I'll say this time without number in previous sessions, but I just want to quickly re-emphasize it. They might be telling you vital signs of a patient that you are going to speak on, or giving you figures. And if you don't write down, you will think you are Mr. Know-it-all. And then when you now cram them in your head, after the whole question has finished, you will now realize that you have forgotten part of it. Documentation is part of nursing, remember. So please, it's not during when they are not calling the question for you, now be telling the interviewer, please give me a few minutes, let me go and get my pen. And then when you even not go out to go and get the pen, you now bring the pen, now realize that the pen is not working. So please, have the writing materials. Now, some of the other factors that can also affect your interview are factors relating to technology, equipment, and so on and so forth. So it could also be a factor relating to your platform. You know that interview can either be on a Zoom session, on Teams session, or any other app, and it could also be on a one-to-one basis. So if you are going for a one-to-one basis interview, please dress smart, comb your hair very well, be decent. I know that it doesn't really matter. Yeah, I know some of you will not tell me, oh, but those doesn't matter. Yeah, it doesn't matter. But again, it still matters to some persons. As I've told you in previous session, if you take your time to watch previous session, you will realize that people have different cultural background. And the person anchoring your interview may not necessarily be a British, and may not necessarily be a Canadian nurse. It might be an immigrant who has now been able to cement his or herself to an upper ladder, and she has the saddle with that responsibility. So if she wants to be able to give you her best, she wants to still put in those things that she already know within her cultural frame that nursing is all about. So you don't want to start explaining to somebody why you decided to do certain things before your interview. If you happen to come to the interview session and you're dressing decently, you all know what indecent dressing could be like, and then you are now being interviewed. The first impression that matters will be that the person that is interviewing you will first of all begin to think of you as negative. It will take you time to even first of all clear that negative notion they have of you before you can be thinking of giving good impression. So why don't you come on an appealing level so that when you now start your session, the focus is on you doing well. So please, let's take note of this. It's extremely important. Now, there are other factors that relate to the technology, such as how you are able to use your team, your Zoom. No, this session is holding on Zoom now. There are some other interview sessions that will hold on Microsoft Teams. So it is your duty to be able to utilize those apps. So they've sent you the interview link now. Copy the link, share it somewhere, open it, and be sure that the app is already on your phone. You cannot start the interview session. Don't be scared that you say, oh, if I click on this link now, what will now happen? What if the session will just start? No, you don't have the power to start the session. Only then can start the session that created the link. So please always remember when you started this Zoom, they were telling you waiting. When this the host comes on, you will be notified. Immediately I started the session, all of you came on board. Same way. So please try to practicalize on how this app that you are using for your session works. It's not that day you will now be trying to know how it works. So please, another thing too is note the name on your app. You can see now some persons are bearing their full name, some are bearing JL, for some is iPhone. So this bear the right name that you are known for, so that when you are communicating, the examiner can easily just write your name against what you are saying, and they can easily just capture you as someone who is doing well or someone who is doing poorly. Yeah, we don't pray for that. I know every one of you will do well by God's grace. So that's that on that. Another thing too is when it comes to name, be careful the name that is appearing on your Zoom, because as you might have heard in our previous sessions, there are some persons that have strange names, like names that are not really ideal. So if you don't look at those names and you are using their Zoom to join meeting, the interviewer may begin to see you as such, unless you will now prove yourself otherwise, instead of focusing on giving the interviewer what they want to hear, you first and foremost start working on your image. So we don't want that. So if you can have a wonderful DP on your session, if you look at this session, I think it's only one person that had DP on a session, which is Miss or Mrs. Emeji. So please, if you can, change your DP to an appropriate good DP of yourself, something that is kind of unique about one of your best features, so that when they see you, it's itself begin to send that attractive imagery. So that's basically it on that. Those are factors relating to technology. You can see that all the 3 factors we mentioned so far, they are under your control. You can control how you speak, you can control your confidence level, you can control your background. Please mute your mic. Oh, this is also a Nurse Okori, mute your mic. This is also under your control. Natalia, mute your mic. Nurse Natalia, mute your mic, please. So these are factors under your control. And we have to remove out. Nurse Natalia, mute your mic. If I remove you might not join the session again. So these are factors that are under your control and factors that are not under your control. So if factors are under your control, please control it. Don't allow the examiner to be the one telling you what to do. Now, there are factors that are not under your control. So those factors are factors relating to the examiner. You can't really do so much about it. It is up to the examiner or your interviewer to be able to put those factors within their check. Factors like maybe they have some prejudice against certain race or culture, or they don't just like your face. So we don't pray for that. But those are not factors under your control. The ones under your control, control it. And again, I can't emphasize this enough. Past questions matters a whole lot. And ENGS past question group on Telegram will go a long way to help your journey in a massive way. Now, the questions you are going to be asked on your interview day will focus on certain key areas. And we have emphasized this time without number. So I'm also going to just highlight some of this area. Number one is they want to know about your background. So these questions are usually questions to put you in the mood, to get you settled, and then get to know about you. Now, there's this good thing about first impression. It matters. First impression matters. The way you start your session matters. If you start your session stammeringly, chances are you might not give a good first impression of yourself. However, if you start your first impression with a good note, with confidence, chances are you've already have a very good confidence booster. So irrespective of how the session looks to you, especially in the first session, please don't bother. If you can maintain your confidence over time, you will see that you will still be strong in the whole interview session. Now, second question focus will be in the aspect of the company or the hospital related question. Now, this is focused on you knowing about the hospital, the trust value, the job role, everything about the hospital. If you really understand the job that you're applying for, and if you have done your due diligence about the country, about the area that you are applying for. So they want to know that. Why are they asking you this? They just want to know whether if you are the type of person that will come to them and begin to struggle, because nobody wants to employ somebody that will come to them eventually will now become a body. So they want you to come and solve problem, not to come and become a problem. So that's basically it on that. Now, another area that you should also expect question to focus on is questions that will relate to your quality or your skill as a nurse. So they want to know, is this person really a qualified nurse? If he's a qualified nurse, as he has claimed, does he have all the necessary skills and experience that we need? It's not just all the necessary skills and experience, but that we need, because you might have an experience in a period of training or in surgical training, and your experience is not in orthopedic. If orthopedic people are the one hiring and they see an orthopedic nurse, they will prioritize an orthopedic nurse before you. Because you work in ICU doesn't mean that when you just go for interview in a other area that is not your field and they see those who are more qualified than you, they will not hire you. No. So please, how do you overcome this? If you know the job description and you know the role you're applying for and you know what they are going to ask, you will give it to them. Give it to them and you have peace of mind and you make progress. So another question that could come, that your question could be focused on, is question relating to what do you want to know, your inquisitive nature. So they want to know how inquisitive are you about the new job. What could be your challenge that you want to find out? Now, a question like this could be when you now finish the session, they're asking you, do you have any question for us? They're asking you this question because they want to know if there are some obscurity or some area that are great that you want to clarify. So I know some of you, when they ask you, do you have any question for us, you begin to ask them, how much are they going to pay me? You don't go and ask for salary in interview session, especially international interview. It's a true off. You don't go there to ask for salary. Every company do have their plan. They have their salary policy. So they cannot start creating policy because of you. If you have gotten the job and then you want to negotiate your salary, it's totally up to you. So please, we always advise, before you can ask those questions, first and foremost, secure the job first. Secure the job first. Another major common mistake some persons will go and make is asking, do you offer COS? You don't they think if you are asking somebody, do you offer COS? It means that you are coming for the COS. You are not necessarily coming to make impact. Mind you, nobody is interested in you. So if you have that mindset, nobody is interested in you, you will begin to change your concept about certain things. Nobody is interested in you, but the trust that you are applying for. Remember, these people that are interviewing you, they have been mandated to get people hired based on certain criteria. And those criteria are what they are looking at. So if you are not going to say, oh, do you offer COS? And they say no, then their mindset has already been made of, okay, this person is in for the COS. So why don't we give another person that doesn't need COS so that we know that there's no stress on us? Now, why do I say don't talk about COS? Don't talk about COS. Let them first of all tell you that you've gotten the offer. You see, interview process is a very strenuous process. Let me give an example with our company, EMGS. When we release vacancy, some of you have seen our vacancy, oh, EMGS is a good thing. When we release vacancy, the HRO, we have to do a very diligent duty of looking at people's CV. After going through people's CV, they will shortlist. After shortlisting, they will conduct interview. After conducting interview, they will select people. Now, if somebody among those they select, they will not go and message others and say, unfortunately, we cannot choose you because we choose other people. Now, after choosing other people now, among those ones you are choosing, if they now reject your offer, there's room for negotiation because you know the process will go through again to start the whole interview process all over. So once you have gotten that offer, the chances of having rejection of because of COS is very slim. But if you go and say it in the interview session, you have already caused the problem for yourself. Allow them to give you the offer first. When they not give you the offer, you will not bring your problem. Now, oh, I need COS. Then they will not say, okay. They wouldn't have told you okay originally, but because they know the process they will go through to go and look for another person now, and they've already told others, unfortunately, because everybody have ego. Imagine you told unfortunately before, you're not going to be there and say, okay, we are changing our mind. They will begin to see the trust as they are not serious. No, because they now realize that you need this thing now, and they've already closed chapter. The people they recruited to do interview, they send them to their various work. You cannot call them back to come and do another session. You know, every interview session is a paid session. You are paid hourly. So that is basically it on that. Know how to construct questions. And if you follow our previous sessions, you will have seen how we say you should address questions when they ask you, do you have any question for us? So this is just a sort of a summary. In today's session, basically, if you are looking for everything you need to know about interview sessions, I think I've tagged some of the previous sessions we've had before, more like a series on the group. So at your convenience, try and watch those videos. Watch them, it will go a long way to impart you and broaden your horizon. So we are not going to be focusing on that today. We are just going to be practicalizing, putting things into action. You ask the question, first and foremost, to get the people in the session to try and answer based on their knowledge. I will make corrections, and then we'll ensure that, okay, we are on the right page, so that all the mistake you want to make, you come and make it here, and hopefully on your day of interview, there will not be any mistake to be made anymore. I'll spend sort of like almost an hour talking. Let's say 40 to 45 minutes. So I will open the session to us now. I will ask the question. If you are ready to answer, you will answer. If you are not ready, I'll start calling names. So that's basically. I want you to take note of this. Before you answer any question, we said interviews what? Telling the examiner what they want to hear. So the first thing you will tell us is, what do you think the examiner wants to hear? And then you will now begin to approach the question from your own angle. So others will also be able to contribute and make appropriate corrections. So I'm just going to flip through some past questions from the Telegram group now, which are so many so far. And then I will see if I can just ask some questions. Okay. Before we go to question and answer, do we have any question? Any question at all? Is there any question? Any area, gray areas? Okay, let's see. Are there any questions? If there are questions, please ask now. It's not on your exam, on your interview day. You will not say things are looking strange. Okay, let's start with addressing question that has to do with tell me about yourself. And we always do this because you can't run away from it. They will always ask you, tell me about yourself. Those are background related questions. So they just want to get to intimate with you. So who want to go first? How do you approach tell me about yourself?
Okay, let me go first.
Okay. All right. Before you go, you tell us the role you're applying for so that we'll see whether it tallies with the role. So if you tell us the role, the department you're applying for, then you cannot tell us about yourself. All right. Go ahead.
Okay. I'm applying for the role of a band 5 staff nurse in surgery division.
Okay, so surgery, that's surgical. So go ahead now.
Okay. Thank you for giving me the opportunity to be interviewed today. I am a registered nurse with current NMC registration and an active PIN. I have diploma in nursing and actively working towards obtaining a degree. I have over 8 years experience across several healthcare settings like the emergency, acute sector, acute settings, and surgical department, which happens to be my most recent role and passion. I've been working here for over 5 years. Here, I have managed I've managed various surgical conditions like appendicitis. Are you there? Hello?
I'm here. It's not that I'm not here. It's just that it's hook. But I understand. But it will get back on track now. So continue.
Okay. I've been working in the surgical unit for the past 5 years. Here, I've managed various patients with surgical conditions like appendicitis, bowel obstructions. I prepared patients for surgery and provided post-operative care for patients. I made sure that all investigations required prior to the surgery were all completed, and I assisted in surgical procedures. I would describe myself as a type of person that is caring. I am compassionate. I am a confident problem solver. I am a strong communicator and a fast worker because I'm able to do things. I'm able to get work completed than an average person. I am a high achiever. In my previous place of work, I was praised during the appraisal week for my strong commitment to work and my flexible job description. I also volunteered in training and mentoring students on placements and junior staff. I provided them with hands-on guidance and answered their questions. I would.
Okay, it's all right. You tried. It's okay. You basically were very detailed. Tell me about yourself. You don't need to be too much detailed. What you can actually work on in this regards. Okay, wait. Before I go ahead to begin to make corrections, why don't I hear from the audience? What do you guys think? How did she do? Critique her.
Okay. I want to say something regarding what she said.
Okay, go ahead.
She tried, but then she was sounding like she's reading from somewhere or that she crammed something. She was not like trying to brainstorm because there was an interview I had and I spoke exactly the way she did. And they called me and told me that I was too fast and I was talking like I crammed what I was talking.
Like a robot.
So she just did the same thing.
Okay. All right, thank you so much. Please, Nosemeji, don't take it to heart. We are here to critique each other so that we can make all the mistake here and go and smash it on exam day. So what she's basically saying, I also observed it. So you spoke in such a way that it looks like,
Stop that.
yeah, please mute your mic, Nosemeji. So you spoke in such a way that it looks as if you were reading. So you shouldn't speak as if you are reading. Mind you,
you say you stop Spokolo, you're allowing to watch Spokolo.
Nosemeji, I will remove you. If you are removed, you will go back.
Sorry.
So you spoke like somebody that was not Mercy, please mute your mic. Mercy Iromosele, mute your mic. Thank you. So you spoke like somebody that was looking at paperwork that he was reading from. You might not have been reading for paperwork. It's obviously meant that you have not practiced well enough. All right. If you practice well enough, it will internalize and it will become a part of you. To make it become a part of you is what we aim for. Now, I can wake up today now and I will hold a session without necessarily practicing. Why? Because I'll be doing it over time. It's not internalized. Every time before I hold the session, I'll practice. So that's the way it goes. The same way it goes for you. So you need to practice it more. Now, you see that when you were talking about the work you have done in your current place of work, that it's got to a point you got stuck. So naturally, you shouldn't get stuck in such a case because normally it's not normal of you what you do every day. You got stuck at some point. So please, in as much as you already have a structure that you want to follow, try your best to do it in such a way that you are so used to it that it flows naturally. And when you are talking, you are looking at the camera and nobody is suspecting that, okay, could she be reading something from somewhere? Just like Nosintia just highlighted now. So does any other person have any comment to the performance of Nosemeji in Tell Me About Yourself? Now, I'm not guiding you now how to tell me about yourself. If you have watched our previous video, you will know how to tell me about yourself. We always tell you that you should start with something, begin to move to another thing, and then you will now go ahead and cap it with your qualities. And we say your qualities should be in resonance with whatsoever values the job is asking for or the hospital is asking for, which are the trust value or the major essential qualities that are reflecting in the job description should be a part of the quality that you are claiming that you have. Remember, if you are a fish and they are looking for a job role for a cat, you have no business there. It is only when you are a cat that you can be able to successfully do well as a cat on a cat role. So what that basically means is if the interviewer is asking you for certain things, that's because it's what they are looking for. So the one that you have that is not relevant to that, don't bring it on board. It will not help you. It is the thing that will help you that you want to what? promote. That's why in life, if you emphasize more of your strength rather than your weakness, chances are you will do well rather than if you always emphasize on your weaknesses. So does anyone have any further correction to what she just did? Okay. All right. So let's not waste time. Can another person have a go?
Yes, I want to try.
All right. Thank you so much. You can go ahead now.
Okay, thank you for having this interview with me. My name is Mercy, and I'm an internationally trained nurse with an active NMC pin. My journey to be a nurse started in my home country, where I obtained a bachelor degree in nursing science in 2019. And ever since, I've been in active service. I have worked in several wards, like the medical wards, specifically the female medical ward, the surgical ward, male surgical ward, and now in the orthopedic ward. Over the years, I'll say that I have some transferable skills, which include, I'll say I'm a good listener. I know how to prioritize. I'm a good communicator, as I prioritize communicating effectively among members of the MDT. I have good problem-solving skills. I'm a fast thinker, and also I am compassionate, I'm patient, and I'm caring. I also have some clinical skills that I've been able to harmonize, which include cannulation, venipuncture, cast application, prevention of surgical site infection, and also wound debridement. Okay. Another. I will also say that I take my personal development very seriously, and over the years, I have been able to attend some trainings, and some of the trainings I've attended trainings of prevention of infections, prevention of surgical site infection, cast application and management.
Okay, all right. Let's stop.
Traction.
Stop.
I don't know.
Thank you so much. So you are going detailed now. So you are going detail. You shouldn't go detail. There are times to go detail. We always recommend that in the very first phase, when they say tell me about yourself, be brief. And most times they will stop you just as I stopped you now. So there are some hospitals they will ask you, they want you to be detailed. They want you to even provide example and everything to back up whatsoever you are giving them. There are some they don't really care. They don't want you to give it to them according to how they want it. The safest option is to be on the balance between. And how do you be on the balance? When you start your session, start with summarizing your qualities and everything. And then when you now go deep into answering the main question, match it up with examples and be much more detailed. Now, if somebody say, tell me about yourself, I say my name. Okay, tell us, what structure do you follow in telling me about yourself now? What structure? Is it you started with your name, your
past, present.
Okay.
I was looking at past, present, and future. So
okay.
My past, my education, present, what I'm currently doing, then my future is what I would like to
Okay,
do.
so we are looking for your past, your present, and then your future. So when you meet your past, your present, your future, how is your focus like? What happens in your past? What is your focus on your past?
My focus on my past is my education.
Okay.
The education, my educational background.
Okay. Then your present is what?
Where I'm my past is my educational background and where I've worked. While my present is what I'm currently doing, the skills I've acquired, my transferable skills, clinical skills, and then my trainings.
Okay. So how about your qualities?
As part of the present.
Okay. Do you know your trust values?
Yes, I do.
What are they?
Okay. Care and compassion. NHS Scotland trust values. Care and compassion. I don't forget the rest. Sorry.
So that's where the problem with
teamwork.
Okay.
Teamwork.
Okay. So teamwork and compassion. What?
Prioritizing.
Okay. So if you want to tell me about yourself now, ideally, you should go like all right, thank you so much for the opportunity. My name is Otaibi Ehizokali. I'm a registered nurse. I don't need to mention my country because of prejudice and people with different thinking mentality. So you can just say I'm a registered nurse. Following my graduation in so and so university, I proceeded to begin working in so and so facility. If you graduated at top of your class, please mention it. If you graduated with any accolade, mention it. I proceeded to begin to work in this facility as an intern nurse. During this period, I was given the opportunity to learn other tutelage. So many, you will hear me say this over and over in previous session. Then from there, you begin to move to your permanent role. So what were you doing in your permanent role? And what you are doing is not what you are doing. It is what the job is asking you for. What is the job description? The things that you have read that they are looking for. They may have told you that they are looking for who can cannulate. They may have told you they are looking for who is a team player. They may have told you that they are looking. Those things that they say they are looking for, mix them up with what you are really doing. Are you getting it? So that by the time they are hearing you, they will be shaking their head, saying, "Oh yes, this is what we are even looking for." Now, when you now want to wrap up with your quality, and your quality should be in line with their value. You don't told me that their value is what compassion, team player. So you will say, when you now want to write, you not say, I am a team player. You not say my qualities are. You say, I am a team player, and I know the importance of working with a multidisciplinary team in order to achieve a centralized goal of a hospital setting. And because of this, I always prioritize team effort. And equally, I am a leader, and I'm also very compassionate. You mentioned that in line with the one you already have stock. So when you now combine everything, it resonates with what they are looking for. Remember, you want to tell them what they want to hear, not what you already know. Forget about past, present, and future. The past, present, and future is just a guide for you. But the inner is what the particular job role that you have. That is not the bone of contention. So when you were summarizing your job description or what you have been doing in your current work, what you have been doing in your current work is not now the area of focus. It is what you are aiming to start doing. That's your area of focus. But you not say, I aim to start doing this. Make it look as if you are already doing it. Frankly speaking, when you eventually relocate, most of these things you will still learn them all over again, because the transition itself is a new phase for you. You understand? So you will still learn everything all over again, and you already have that background. So I think following it that way to really go a long way. But again, if you follow our previous video, we really focus on tell me about yourself very well. So I will not want us to dwell too much on this. Does anyone have any addition to what she just did? Nurse Mercy? Okay.
So I want to try.
Oh, you still want to try? I wanted
Yes,
to
sir.
go ahead, though. Go ahead, ma.
Okay, thank you, sir. So my role is public health student for the specialist community public health nursing, and the trust is Rotherham Trust. So
Okay.
I'm starting now. My name is Ikere Miracle Aqua, and I'm a registered nurse. I have a bachelor's degree in nursing science. I've worked in various areas, including acute and community settings. In the hospital, I've worked in pediatric medical and surgical wards. I've worked in the sick care baby unit. I've worked in the children emergency ward and neonatal intensive care units. In the community, I've worked in primary healthcare centers and in schools. I have interest in public health nursing, which actually led me to become a registered public health nurse in West Africa. So this shows how ambitious I am. Also, I'm so passionate about community nursing because I believe that community nursing allows me to provide holistic care to my patients, because there are things that cannot be assessed just being in the hospital alone. But through community nursing, I'm able to go to my patient houses, go to their community, and perform a health needs assessment and provide care based on the assessment, plan the care, implement the care, and evaluate the care. I'm also very passionate about volunteering. So I volunteered my nursing experience in communities that are disadvantaged. And during this volunteering, I worked with other people like the doctors, physiotherapists, pharmacists, and even the optometrists to provide reading classes for the elderly. I'm quite passionate about public health because I believe that it's better to prevent a disease than to cure it, because public health deals with health promotion and disease prevention. And there's this quote by Virginia Anderson that keeps me on my toes, which says that maybe this one moment with this one person is the very reason we are here at this time. Thank you very much.
Okay, thank you so much. At the latter phase of your communication, it seemed, was it that you were, I don't know, it looks as if you were not reading. You started very, very well. Like, if you put everything together, you just said now, I feel you have a very good background. But
You,
if you play your voice note again, maybe
Oh.
when this recording is sent, you go and listen to it again. You see that at some point during the latter phase, maybe you were not catching your breath or something.
Yes,
or,
I think I'm anxious.
Okay, so probably that's why. So please don't be anxious. It's just a session that will come and go. You prepare over and over. It might just take 15 or 20 minutes for you to display everything you have been preparing. So you have to give it your really best shot. So kudos to what you've done. So what are your trust values?
Ambition, caring, and together.
Okay, ambition,
caring, and together.
So did you demonstrate that in the course of your conversation?
Yeah, I said that I'm ambitious. That's why I became a public health nurse in West Africa.
Okay.
Then I talked about how community nursing will help me to provide holistic nursing care.
Okay.
Then together, I said for volunteering experiences, I work with other people like the doctors, physiotherapists, and optometrists to provide care for communities that are disadvantaged.
Okay, that's very, 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 very nice. But